Did you know that your body could be sending you hidden clues about the health of your liver? You might be surprised to learn that signs of liver disease often show up in the most unexpected places: your skin, nails, even your breath. It's not just about feeling sick. Your body may be trying to tell you something long before symptoms become noticeable. As a doctor who sees liver disease daily, I can tell you that early detection is key to preventing serious complications. In today's video, we're going to uncover 12 surprising signs of liver disease that you can easily spot on your own. Trust me, this knowledge could make all the difference. Stay with us as we break down the subtle, but telling clues that could change how you approach your health. And remember, the more you know, the more empowered you become. Liver disease is often a silent condition, gradually affecting various systems of the body without any immediate warning. However, if you pay attention to your body, there are a number of signs that can offer clues about the health of your liver. These signs, ranging from changes in your nails to more severe symptoms like difficulty breathing, can be warning signals that you should not ignore. Let's dive deeper into some of the most prominent signs of liver disease that can appear on your body, particularly focusing on the often overlooked clues that show up on your skin, nails, and other parts of your body. 1. Nail changes. White lines, W lines, and pale nails. Terry's nails. Your nails are a reflection of your overall health. They grow through a complex, energy-intensive process, and changes in your body's health often show up in your nails. Liver disease is no exception. One of the most noticeable signs of liver issues is the appearance of white lines running horizontally across the nails, also known as W lines. These white lines aren't actually on the surface of the nail itself. Instead, they're located underneath the nail. If you gently apply pressure to the nail, you may notice that the lines temporarily disappear. As your nail continues to grow, the line will stay in place because it's embedded in the tissue beneath the nail. Another key indicator is Terry's nails. Normally, nails have a healthy pinkish color due to the tiny blood vessels under the nail. But when liver disease is present, these blood vessels may become harder to see, leading to nails that appear abnormally pale. If you suspect you might have Terry's nails, check the lunula, the small, half-moon shape at the base of your nail. Having a visible lunula generally means your nails are not affected by liver disease. However, if the entire nail is pale and you're seeing no color at all, it could be a sign that something isn't quite right with your liver. Both of these nail findings, W lines and Terry's nails, are often linked to low albumin levels in the body. Albumin is an important protein produced by the liver, and its deficiency can be an early indicator of liver disease. 2. Clubbing. The diamond-shaped Japanather telltale sign of liver disease is clubbing of the nails. When you place your nails together, you might normally see a small, diamond-shaped gap between the bases of your nails. This is completely normal. However, in some people with liver disease, this gap may not be present, and instead, their nails may begin to curve downward, becoming more rounded and thickened. This condition is referred to as clubbing, and while it can be genetic in some cases, its appearance often signals an issue with the heart, lungs, or liver. When I spot clubbing in a patient, I immediately consider liver disease as one of the potential causes. It's one of those subtle signs that could make all the difference when it comes to diagnosing a serious condition. 3. Ascites. Fluid buildup in the abdomenocytes is another physical manifestation of liver disease. If you notice that your abdomen is suddenly distended and swollen, it could be due to fluid buildup in the abdominal cavity. Often mistaken for pregnancy due to the prominent belly shape, ascites is a condition where the abdomen fills with fluid, sometimes as much as 15 liters or more. To understand why this happens, we need to look at the liver's role in processing blood from the digestive system. After food is absorbed by the small intestine, the blood from the intestines is routed through the liver to filter out harmful substances. However, as liver disease progresses, the liver becomes scarred and stiff. This scarring obstructs the flow of blood through the liver's blood vessels, creating increased pressure in the portal vein. Think of this like pinching off a garden hose. When blood cannot flow through the liver properly, pressure builds up. This pressure, known as portal hypertension, forces fluid through the walls of the portal vein, leading to the buildup of fluid in the abdomen, causing the painful and uncomfortable condition known as ascites. Patients with ascites often find it difficult to breathe, as the fluid pushes against their diaphragm. In severe cases, draining the fluid via a procedure called paracentesis can provide immediate relief. 4. Caput medusa, swollen veins around the belly button. Another sign of portal hypertension. Caput medusa can be seen around the belly button. The condition occurs when the blood pressure in the portal vein increases so much that blood has to find alternate routes to return to the heart. These smaller veins, not designed to carry the extra blood flow, become enlarged and swollen, creating a distinctive pattern of twisting veins around the belly button. This appearance is similar to the snake-covered head of Medusa in Greek mythology, which is why it's called caput medusa. Caput medusa is often an indicator of severe liver disease and portal hypertension, and it's another important physical sign that should prompt further evaluation. 5. Spider nevi, dilated blood vessels on the skin. When liver disease causes hormonal imbalances, particularly in estrogen, it can lead to a condition known as spider nevi. Spider nevi are dilated blood vessels on the skin that have a distinctive, spider-like appearance. These tiny blood vessels are caused by the effects of high estrogen levels, which the liver normally breaks down. When the liver isn't functioning properly, estrogen accumulates in the body, leading to these visible blood vessels. If you notice 3 or more spider nevi on your skin, it could be a sign of liver disease. While it's normal to have 1 or 2 spider nevi, the appearance of several, particularly in the absence of pregnancy, another common cause of high estrogen levels, should raise concern. 6. Muscle wasting. Breakdown of muscle tissue. As liver disease progresses, the liver's ability to process nutrients, store energy, and make proteins becomes compromised. One of the unfortunate consequences of this is muscle wasting. When the liver is no longer able to supply the body with the necessary nutrients and energy, it starts breaking down muscle tissue to fuel the body. This muscle wasting is often most visible in areas like the temples or palms of the hands, where muscle tissue is located close to the skin surface. It may not be immediately obvious, but if you notice significant thinning or muscle loss in these areas, it could be a subtle sign that your liver is struggling to function properly. 7. Dupuytren's contracture, tightening of palm fascia. Another sign of liver disease is Dupuytren's contracture, a condition where the fascia in the palm of the hand thickens and tightens over time. This leads to progressive finger contractures, particularly affecting the 4th and 5th fingers. The condition is sometimes referred to as Viking disease, because it's common among people of Northern European descent. If you notice that your fingers are difficult to straighten, or if your palm feels tight when you try to flatten your hand, this could be a sign of Dupuytren's contracture. You can test for this by performing a tabletop test, where you lay your hand flat on a table. If your palm doesn't touch the table because your fingers are too tightly bent, it might be an indication of this condition. 8. Asterixis. Involuntary hand tremor. When liver disease reaches an advanced stage, asterixis may develop. This is an involuntary hand tremor, sometimes referred to as liver flap. When you extend your arms and wrists, you may notice an involuntary flapping of your hands, which is a sign of liver-related brain dysfunction. This occurs because the liver is no longer able to clear toxins, particularly ammonia, from the blood. Ammonia buildup affects the brain, leading to this characteristic tremor. Asterixis is often a sign of hepatic encephalopathy, a potentially life-threatening condition where the liver's inability to process toxins leads to cognitive impairment. This is one of the more serious complications of liver disease and warrants immediate medical attention. 9. Fetor hepaticus. Musty breath odor. If you notice a musty breath odor, known as fetor hepaticus, this is a key sign of advanced liver disease. This foul-smelling breath is caused by the buildup of toxins like dimethyl sulfide in the bloodstream, which are then exhaled with carbon dioxide. The distinctive smell is often described as sweet or musty. In my clinical experience, I've encountered several patients with fetor hepaticus often as a result of hepatic encephalopathy caused by ammonia buildup in the body. This symptom is another red flag that your liver may be in serious distress. 10. Jaundice. Yellowing of the skin and eyes. Jaundice is one of the most obvious and unmistakable signs of liver disease. It occurs when the liver is unable to process and eliminate bilirubin, a substance produced during the breakdown of red blood cells. As bilirubin builds up in the bloodstream, it can cause the skin and the whites of the eyes to turn yellow. This is jaundice, and it's often one of the first symptoms that leads people to seek medical attention for liver problems. In addition to yellow skin and eyes, jaundice can also cause your urine to turn a dark, tea-colored brown. If you notice these changes, it's important to seek medical advice as soon as possible, as jaundice can be a sign of serious liver dysfunction. 11. Easy bruising. Low clotting factors and platelets. Liver disease can also affect your body's ability to form blood clots, which can lead to easy bruising. When the liver is compromised, it produces fewer clotting factors and platelets, which are essential for stopping bleeding. As a result, even minor injuries can cause significant bruising, and the bruises may take longer to heal than usual. If you find yourself bruising easily or noticing large bruises that appear for no apparent reason, this could be a sign that your liver is not functioning properly. It's a common symptom in patients with cirrhosis and other advanced liver conditions. Conclusion: prevention and early detection are key. While there is no cure for liver disease aside from a liver transplant, the good news is that many liver conditions can be prevented or managed if detected early. Lifestyle changes, such as reducing alcohol intake, maintaining a healthy weight, and addressing chronic viral infections like hepatitis B and C, can help prevent liver disease from progressing. By staying vigilant and looking out for these signs, you can take proactive steps to protect your liver and overall health. If you notice any of these symptoms, don't wait for them to worsen. Seek medical attention and get the care you need to stay healthy. Now that you've learned about these crucial signs of liver disease, remember that awareness is your first line of defense. Your liver plays an essential role in keeping your body healthy, and by recognizing these warning signals early, you can take proactive steps to protect it. Whether it's adjusting your lifestyle, seeking medical advice, or just becoming more mindful of changes in your body, prevention is always better than cure. And if you found this video helpful, don't forget to support the Health Horizon YouTube channel by liking, subscribing, and sharing with friends and family. We're committed to bringing you more valuable insights about health and wellness, because when you stay informed, you stay healthy. Until next time, stay curious, stay healthy, and we'll see you in the next video.